intended to give you the truth of what nursing is about. And hopefully you've been watching some of my other videos and you see that I've been trying to give you the truth while you make a decision on whether or not you want to become a nurse or go to nursing school. But most of the time, if you ask a person why they want to become a nurse, the answer will be because they want to help people. So this video is intended to give you some truth of why you need more than that if you want to become a nurse. Again, this is not meant to deter you from becoming a nurse, but just the simple fact of wanting to help people, it can take a toll on you. So I'm going to give you a few reasons or a few things that you might encounter becoming a nurse and why it is important to have something else to help you get through your role as a nurse should you decide to become one. Number one, there's an emotional toll with nursing. It can be taxing. You will have patients that will die on you. You will have patients with sad stories, maybe even children that have gotten molested. Things that you feel helpless, that you cannot control, that your treatments are not working, things of that nature. So if you are sensitive to those things, simply wanting to help people and watching your help not help them can take a toll on you emotionally. So you have to be ready for that fact, that 100% fact when it comes to the nursing career or probably any medical profession. The second thing is the physical demands. This job is physically taxing, especially if you work in an acute care facility, a long-term care facility, a skilled nursing facility, a long-term acute care hospital, outpatient, ambulatory surgery. It's all physically demanding. You're going to have to move patients, pull patients, push patients. You're going to have to do total care. There are a lot of things you're going to have to do. You're going to have to most likely be on your feet. If not the whole day, the majority of the time, because you're going to need time to sit down and chart. Or sometimes you might be on your feet the whole shift. It just depends how the shift goes. And each day, it's going to be different. So aside from wanting to help people, you have to also be ready for the physical demands of the job. Number three, the work of a nurse is stressful, to say the least. I'm speaking from a med-surg environment with some experience in the emergency department. It's stressful. You don't know, as I mentioned before, what to expect day to day, shift to shift. It's all different. You could be dealing with a patient that is so critical, on the verge, speaking for med-surg, on the verge of needing to be transferred to the ICU because they're just going to tank on you. Their blood pressure is just going to tank. Something of that nature. You're going to have to monitor. You're going to have to be on your toes, like figuratively, but also literally. You're going to have to be on your toes. Make sure those orders are completed on time, those medications are passed on time, and that you are communicating with the team. You need to make sure that you are alert at all times, and those call lights could be ringing. There's alarms all over the place. There's just chaos on some days of the shift. You might have to run to another person's room to participate in running a code, CPR, whatever it is. It can be stressful. It is also very rewarding. Let me also say that. So I don't want to scare you away, but it can also be very rewarding, the things that you encounter, the patients that you encounter, especially when they're very appreciative of your care. And that's another thing. They may not be appreciative of your care. As much as you want to help, you'll get those people that are entitled. You'll get those people that we refer to as frequent flyers, meaning they're always in the hospital due to their own neglect of themselves, or they're on drugs, or they're a prostitute. So you kind of get to know them by name. You kind of get to know that they're there for a reason. They might be there, speaking of a prostitute, because they're there to deliver their third, fourth, fifth baby and then move on with their life. They're just going to deliver the baby and leave without the baby. So you get to know who these people are. You are to remain non-judgmental and move on with your work. So that's another part of the stressful situations. Number 4 is shift work. You have to be able to be flexible and know that whatever unit that you're on, you may be required to come in on call. You know, they'll give you a few hours. They'll tell you what those hours are before you come in. They'll call you before your shift begins a few hours in advance and let you know you're on call for that night, which means that there's an allotted time before they will call you in for a shift if they need you. So you'll be up, if you're a night shift nurse, you'll be up until 2 o'clock in the morning just waiting for that call, or whatever time limit your particular hospital has. You have to be ready to go at a moment's notice. Your sleep, circadian rhythms, your sleep patterns will get jacked up. Like if you're a night nurse, you won't be normal as far as your sleep pattern for a while. And by the time your sleep pattern normalizes, let's say you have a 3 or 4 days where you won't be going to work because you're going to be completing your 3-day work week. And by the grace of God, you have it all lined up to where you have 4 days off, right, in a row. By the time you hit that 4th day that you're off, it'll be time to go back to work, and that'll be the day that your sleep pattern normalizes or you feel less tired. So you have to be ready for that when it comes to your body, your health, and everything else. Number 5, limited personal time. As I just mentioned about the shift work and your circadian rhythms being messed up and feeling fatigue when you're off, you have limited personal time. Not to mention that you will have a 12-hour shift. I hear Kaiser has an 8-hour shift. I'm not sure about that, but you will have a 12-hour shift and you will be required to be on at all times, like alert. And when your days are off, there's 24 hours in a day. So if you work 12 of them and then you have a shift the next day, it's just very hard to get that personal time in without feeling fatigued or like you can't complete whatever it is that you want to do in your own personal time. If it's, go to a game that your babies are at, that your sons or daughters are at, you'll probably feel so fatigued that you probably won't make it, or you'll be there with less alert, less attention, but you'll be there physically but not mentally because you're so tired. It's just, you have less time for yourself. And give or take, you probably have about 3 or 4 hours when you get home from a 12-hour shift before you end up going to sleep on some days. And I'm speaking to my older crowd, or my crowd that has other responsibilities in their lives, such as children or older parents to take care of, somebody else in their life. So that is another thing that you will have to deal with. Number 6 is the fact that you will have to make high stakes decisions with very limited time. As a nurse, you are the person that is there with eyes on the patient at all times. It's not the doctor, it is you. So you must be alert and you must be able to make decisions in the blink of an eye. If you see a patient declining or signs that they are declining, you must be able to make those calls. Call a rapid response, code blue, whatever it is, you must be able to do that. And sometimes, even though you make those decisions, they will be bad decisions. There will be times where you miss it. And you have to be ready for the emotional toll that will take on you for not being alert enough or not recognizing the signs of somebody declining, even if it's something that's rare, like a rare sign. So you have to be able to forgive yourself and deal with all that comes with making that high stake decision. Again, you are the only thing between that patient and death at the time, because you are the one that's there with them the majority of the time, not the doctor. So that's something else you need to consider. Number 7 is that you're putting your life on the line, not only when dealing with hostile patients, but also exposure to illnesses and sicknesses. We just came out of the pandemic. COVID was a very real thing. And to make the decision to get up and go to work, despite the fact that the rest of the country is down and on lockdown, we still needed to get up and go to work, make that decision that we're going to possibly expose ourselves to this very real thing, this disease that has killed many people, and just make that decision and go with it. You are supposed to be dependable, you are counted upon, and you need to be there. Even if a patient has the Ebola virus or a rare virus you've never seen before, you're going to have to make that decision to be there and show up. There is no, oh, my patient has scabies or my patient has the Ebola virus and I don't want to go in there. You're going to end up neglecting and deserting your patient. That's going to be bad for your license. So you're going to need to make that decision to show up in the face of danger. Even when these patients lash out and they're mad at you or they want to attack you, you have to be prepared for the fact that you may have those days where the patient's not in their right mind, or they are in their right mind and they just want, they just want to take out their anger on you. You have to be prepared for that. Number 8 is the bureaucracy and the administration of hospitals or whatever company you're working for. You may need to chart. You obviously need to chart. You will have to deal with paperwork you don't want to deal with. You may have to deal with changing policies and procedures that will get on your last nerve. And they may change all the time. And by the time you get the hang of one procedure and policy, it will change. Rules and regulations that you don't necessarily agree with. For example, the COVID shot. It was rolled out to the healthcare workers at first, and it was almost like we were the guinea pigs for it, not knowing the effects of it, right? And so we needed to take it. We were required to take it. Either that or you lose your job. So that was a hard decision to make for some of us, and some of us left our job because we weren't going to let that control us, and some of us gladly took the shot. It just depends, and you will have to make those hard decisions and deal with things that you may not necessarily agree with. Number 9, low pay and job security. As a nurse, I believe that some of these hospitals and companies think that you're a dime a dozen. Where one nurse is going to quit the job, there will be another nurse waiting in line. They always say that we need more nurses. But I believe that we do have enough nurses. It's just the fact that we want the hospitals and the administration, the hospitals want nurses that are experienced. So while we're rolling out new nurses, they aren't in demand as experienced nurses are. But still, there is the low pay. At the end of a shift, you may feel like you busted your butt that day, that you feel like you deserve more than you are getting. And let me tell you, that is right. With the things that you deal with, you're worth more than that. But that is something that you'll have to understand and come to terms with. You will always be able to negotiate your pay as you get more experience and decide and pick and choose who you will work for. So just keep that in mind. But there's high turnover in nursing. I will say that. There's also those nurses that feel that they have a grasp on the job and they stay there long term. But it's limited job security. Like I said before, you are treated as though this is a revolving door. Number 10, I think. There's lack of autonomy in your job. For the most part, when you work on your shift, you're left alone. It's not like somebody's micromanaging to make sure that you fulfill every order that is given to your patient. But you are at the hands, or you are supposed to fulfill the orders of the physician. You need to carry them out. It's not that you can listen to the patient and you actually hear what they're going through and come up with your own things. Sometimes you can, but most likely you will need to run it past the MD. A lot of things require an order. For example, on my floor in my hospital, I needed an order for a cough drop to give to a patient. It wasn't anything fancy. It was a regular old cough drop. So I needed a physician order. I couldn't give the cough drop to the patient even though they're like coughing throughout the night. So thankfully I got that order and was able to give that cough drop. But the simple things that you think you should be able to do, it may surprise you on what you're not able to do. You can definitely elevate a foot or something like that, but it depends on what the patient's going through and what they're there for. So I wanted to give you honesty in what you will be dealing with and let you know that if you are prepared to deal with all that I just mentioned, and another thing that I didn't mention is your teammates. There's a lot of nurse bullying that can happen, especially if you're new. Can happen. I'm not saying that this happens to everyone. For some reason, it's like a sorority where you'll get hazed or treated like you're a newcomer and you have initiation week or something like that. But you have to be ready for horrible nurses that have been there for years that have something against new nurses. It's ridiculous. For my male nurses, if you're going to become a nurse, you have to be ready to understand that this is a typical female industry or career. So if you're working in L&D, there might be some labor and delivery. There might be some uncomfortableness in having a male nurse. There are lots of times, not just in L&D, where your patient will be a female and she will feel uncomfortable with you. You have to be ready for that and understand that and have empathy for that. So these are just some truths of what you will deal with in the position. Not all of these can be applicable to your situation when you do become a nurse. But I wanted to give you an eye-opener of what can potentially happen and what you will have to deal with as a nurse. If anyone can think of anything else and you've been a nurse for a while, please drop them down below. Again, not meant to deter you from becoming a nurse, but these are things that I wish someone would have told me before I became a nurse. If you are ready and willing to deal with these things, then go ahead, by all means, become a nurse. But I just wanted to give you the truth of it all before you go in head first, just wanting to help people. Be ready for the fact that your help may not be wanted on some days. There will be combative patients that don't want your help. There are also patients that don't listen to you. Be ready for that. There are patients that you do the best that you can, and even though you help them, it fails. So emotionally be ready. If you are the type of person that can handle this, by all means, come into this profession and do the best you can and be the amazing nurse that you will be. But if you are not ready for this, take some time maybe, think on it, or consider another profession within healthcare. There's always a need for ultrasound techs, radiologists, doctors, but I imagine doctors deal with a lot more, but who knows? Anyway, hope you found this video useful and helpful, and hope to catch you in the next video. Bye.